Hi everyone, my name is Ed. I'm here to talk to you about the Shockwave machine that we use here at the practice. Sometimes called the radial pressure wave machine. I like that better because everyone hears the shockwave, they think they're going to get electrical shock. We use it for mainly our tendon issues and speeding up the recovery of tendon issues, because as we know, tendons can be quite hard to settle down. Mainly for the tennis elbow, golfer's elbow, Achilles, patella tendon, especially much the plantar fascia issues that people get. Also gluteal tendinopathies, and quite significantly it's used quite a bit for the calcification of the rotator cuff or shoulder tendon issues that are commonly out there. What I'm going to show to you now is how we actually start it up and get it going. But one of the things that we do with this machine is that we try to get the pressure that's going into the tissue as high as we can, because that helps, it seems to get a better effect the higher that you can tolerate. The reason that we use the machine is that the tendon issues that we come across tend to be a failed healing response. So the tendon gets irritated, it's not going through its normal healing response, and therefore it perpetuates itself and goes on and on for quite some time. And it's something that we find that tendons are slow to resolve because of that issue. The use of the pressure wave machine helps stimulate or reboot that healing process. So we're finding that people who may take 3 or 4 months to do their rehab programs are taking 6 weeks to get through their rehab programs, because it gives them pain relief, reboots the healing process, and then people are able to progress through their program a lot faster. So let's move on and let's get hold of the little machine and let's get going. So it looks a little daunting, this large machine head. Part of the pressure comes from a small projectile running down the end of the hair by compressed air, hits the end, and then it creates a pressure wave, and that pressure wave then is penetrated into the tissue. We will tend to, with our machines, find the spots that we find that's quite uncomfortable, get a marker pen. There'll be certain areas that are worse than others. We mark the spots for the area. Then we use a bit of gel, and the gel's quite good because that allows for the pressure wave to be transferred quite comfortably into the area. I've got this up into here. We pop the head on. So it's not actually someone pushing firmly on the tendon, but what you'll find is, what we tend to do is get the gel over the area, and I'm going to turn it on by pressing the little button in here, and it will start it up. Alright. Makes quite a bit of noise as the projectile goes down over the top of the tendon area. Come around, and we'll turn that up as far as the person can actually tolerate. So I'm just going to turn that off again in a second, just so we can hear ourselves talk. There it is. So we tend to just move around the tendon area. We try not to stay in one spot for too long, especially where the tendon has been irritated. Sometimes people will come in with scans and they'll show that there's some deterioration of the tendon. We're not going to necessarily cure the deterioration of the tendon, but what we will do is stimulate the healing of the healthy tendon that's around that area and making it help progress through the program. We do that until the machine actually stops. It goes to a few thousand pulses at a time, and sometimes we'll change the head depending if we have to go into the muscle area. It's fairly straightforward. It's nothing too daunting. It can be a little uncomfortable, but the results have been fantastic so far. We've been really happy with the machine, because one of the hardest things for us to do with our patients is to get them into the programs. We're trying to get the patient to do the exercises over a long period of time. The shorter that period of time occurs means that more likely the people are actually going to commit to the program and complete it. And we're finding more people are completing the programs and getting better results when we use the exercise in conjunction with the Shockwave machine. Interesting enough, we've even had a few patients come in and go, I'm not doing any exercise, I just want the Shockwave. And we've actually had pretty good results from that too. So although I'm very much an exercise person, I have been persuaded to and convinced that the use of both together is a very good way of getting people better faster. Okay, thanks for your time. Bye.